We go.
Hello. Welcome to Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please continue watching. I'm composing a spontaneous comment or question, someone's processing their thoughts, in addition to repeating something that was unintelligible or misunderstood. It is natural discourse, and we can choose not to say anything while this is occurring. Today, I have Michelle Turner with me. She is here to discuss how she helps families thrive and see the possibilities through the power of touch. I know about you through a huge Facebook support group called CP Warriors, Mommies, Daddies, Grandparents, and Caregivers. You actually have worked with the family that runs it, the Reynolds.
Rookie.
Michelle Turner, creator of Movement Lesson, is one of the leading experts in infant and child development and movement specialist. She is an influencer, author, presenter of the largest library of working with the human body. She can be found all over the world, in person, YouTube, Facebook, bookstores, and podcasts, helping parents and practitioners with finding a better way to move, making the impossible possible. Welcome, Michelle.
Hi, Kayla. Thank you for having me.
Please introduce yourself.
Well, like you said, I'm Michelle Turner. I am a mother of two great boys, I guess men, and I'm here because of my son. My son special needs. He's about to graduate from college, and they said back then that he probably wouldn't see, walk, or talk, and that's how I got here.
I am Kayla Ireland. I have spastic quadriplegia, cerebral palsy, and epilepsy. Cerebral palsy affects all my motor skills, so I need physical help doing everything. I am a power wheelchair user. However, I can take some independent steps and small transfers, like from my bed to wheelchair or from my wheelchair to the couch. I use an adaptive joystick to operate my laptop. In addition to having to be fed, I have a swallowing disorder. My mealtimes are complicated because I have to take small bites and sips, make sure that food is on my teeth and not stuck on the roof of my mouth. At what juncture in your life did Movement Lesson come about?
My son was fine until 13 months, and he did get vaccinated. And instead of getting the antibodies, he got the disease. So Haemophilus influenza went behind his eyes into his base of his brain. And he went from walking and talking or cruising at 13 months to he couldn't even roll over. And I thought he was sick. I thought it would last a day. It was a week, and then it was a month, and then it was longer, until we started getting the diagnoses of his motor issues, his visual issues. He wasn't physically diagnosed until he was 4, but at 4, he was diagnosed as mentally retarded, which was a diagnosis back then. He's 20, going to be 22. Now it's cognitive impairment. And that at that point, I just got really mad and said, I'm done and I'm going to take over his care, not to start a business, but to bring my son forward and see the he really taught me to see the possibilities in everybody. He really taught me a lot of great gifts. He's an amazing human being, as are all of us, but still. And I slowly, it was like, there's some lady doing something with her kid. You should go talk to her. And I was like, okay. And that's how it started.
Were you interested in this field before Graham?
I had no idea it even existed. Unfortunately, one of the things I tell people, I think within 10 years, honestly, every family is going to have a child, a special child. The increase in what's going on with our munchkins is astronomical, but I'm 60 years old. I just turned 60. And I'm telling you, back then, there was just one person in my town that had cerebral palsy. And it just didn't exist like it does now.
Did you like biology?
I did. I was actually on the biology team, which I don't know if that meant anything. I certainly wasn't like the people you see on TV. And I still am really studying the space program to great degrees right now. It's quite interesting because I have a book out called "You Can't Get to Mars Without Me," and I mean it. And if they don't practice what I'm trying to tell them, the astronauts will not survive in outer space.
What were your experiences with traditional therapies as a mom?
Okay, I have to say this lovingly. Everybody is out there to help our kids in their way of doing it. What was frustrating though as a parent when my son didn't do it, because I thought he would just walk again. I didn't know you could just stop walking. And he does walk now, but they said he would never walk or talk. At 4, his goal was to say mom. He really was nonverbal, and he was going to Foundation for the Blind at that time. So, but everything was my son's fault. And that was the hard part. Oh, if only he was stronger. If only he was. I'm like, well, he's not. That's why I'm here. And, and then so that was a frustrating part. Why is it my 3, 4, 5? Why is it his fault? Like do something different for my son. And so that's where I got frustrated.
Throughout the years, I have participated in top soccer and therapeutic riding in addition to aquatic, physical, occupational, speech and feeding therapy. My overall experience was good.
That's great. No, if it helps you, it's wonderful. When it doesn't, it's frustrating.
How or why is the traditional approach not movement based?
Um, they're more brain based, but a lot of people believe if you change the brain, heal the brain, move the brain around, the body will work. I believe babies are not born saying, "Hey, mom, I want a cold one in the fridge. Let's go." It's movement comes first. That's why speech and so forth. Until a person is walking, speech really doesn't come about. I really look at movement and functional movement, things that you need, like to eat. Functional movement is the priority that needs to be taken care of.
How do you feel about traditional treatments like Botox?
I think Botox is necessary. Now, do I look at a child or anybody with cerebral palsy and really it's Botox, baclofen, and AFOs, and kiddos with perfectly good feet and they're in AFOs. I don't understand it. Where you don't want is the contractures, especially within the ankles, that can get pretty severe. But Botox is paralysis, so you're stopping the spasticity, But in many cases, you're stopping a child or adult's balance. And so when you Botox a certain area that maybe is for balance and you see it as spasticity, the arm might go down, but now they have to balance elsewhere. And that's where you're getting issues, especially in spastic quad, not with everybody, but whoever is doing the Botox really has to understand function and movement. Um, and that's where the problem, the complications could.
Pursued any of these. A lot of factors go into how tight we are, like hormones or stress. I have made so much progress naturally, even though I use a wheelchair. I used to need my parents' help to do homework every night, but as the material got more involved, it's easier for me to do it independently rather than explaining it to someone, except for math. Every time I see my neurologist, adding spasticity meds come up, but I'm always like, what's my normal? In 2016, my left leg brace kept breaking and I started getting blisters repeatedly. We went to the orthotist and a physiatrist referral was made. My high muscle tone was making them break. The physiatrist, of course, offered the CP treatments that I can't imagine doing. So the orthotist made me a new brace with an extra smaller piece to put on before I put my left brace on.
Yeah, like I said, when you're with someone that understands movement and your functions, they're amazing. But a lot of people just say, no, this is what we do and this is what you're going to get. And, it doesn't always work for everybody. And it's okay if it doesn't work for everybody. That's why we're different.
Should we be assessed for equipment differently based on your modality?
Yes, first of all, I'm a really big advocate with vision. A lot of munchkins have issues with vision. It could be because they can't position their body to see, as well as they're just needing what people think is needing glasses. Most people think of vision as glasses. A lot of it is, I might be easiest for me to look this way, but for someone else, they might have to turn all the way around to see. So again, if you're putting equipment on a person that, let's say, is going to interrupt their vision, you got to save the vision. The vision's the most important. How to use your devices. How are you going to talk? How are you going to communicate? How are you going to see your food? And so again, that might be one of many reasons why looking at function and movement, what we can do for the whole body to work together versus restricting. And now I can't look and I can't go around to look hard. Like I said, as an example.
Please talk about how intake forms aren't accurate.
Oh gosh, first of all, my son was
Oh.
he was diagnosed again that he was mentally retarded. Again, hate to use that word, people get all upset, but again, that was back then. The reason I sort of laugh about it, because one time his support coordinator said, "You forgot, he's also mentally retarded." And I'm like, how do you say this? But you have to learn, it's sort of like Voldemort, you have to learn to say it. And it just was our situation. Yes, it's cognitive impairment. My son does not eat. And that when I found out the IQ test was based off of food, and I'm like, he doesn't know what ham is, he doesn't know what jam is, he doesn't know what jelly is, he doesn't know what these things. And they're like, that's why he has issues, he doesn't understand, because he should know these things. I said, why? If I was Asian, I wouldn't know what ham is. If I was Jewish, I wouldn't know what ham is. So again, a simple example of an intake form. And another reason why my son, they didn't want, I took him off of school services end of third grade. And they said he can't stand on one foot. And I said, what? He can high round kick you to the head because he did karate and he could walk. How is he not standing on one foot? And they're like, well, he needs to stand on one foot and bend the other leg. And I looked at her and I said, he's not a flamingo. So these are just, again, there's variations of intake forms, but asking you to stand up and balance, let's say, versus for you to be more accessible in a wheelchair to do more things, what's better in your life? And there's many reasons for different types of intake forms.
Is eating sensory for him?
It's not only sensory, but again, he had this massive infection that nobody found. It went from behind his eyes into the base of the brain. So all this was just horrible pus, mucus, and it drained down his throat constantly. So he just was always getting sick, and so food to him just didn't, it wasn't fun. It didn't taste good. Um, Before he got sick, he would eat anything. And yes, it became, most people would say it was sensory, but he just didn't enjoy it. We enjoy our foods. It was so difficult for him to eat.
Your client and or their families have to decide what they want to work on when they schedule their intensive?
Yes and no. A lot of people know my reputation, and they say you do what you feel is best. And a lot of people too are coming in from traditional therapies, so they're not used to, again, the vision component and all that needs to be done. I mean, I've found kiddos that just could not see past 2 feet. They have directionality, but that doesn't mean they can see. And so I'm big on catching the vision. And then also too, if you want a child, let's say, to walk, they have to be able to look down the hallway, and so they have to coordinate those things. But yes, there's some people that want to be very specific, and I work around them. Parents are stressed and they need help, and sometimes their help is very micromanaged, and sometimes it's global, and that's how we work with people.
How do you know the difference between vision and physical?
Oh, you can feel vision in someone's back. Just from looking down at my paper to looking up, right? All my bones go with vision. Vision first is, and that's why babies aren't meant to see right when they're born. Vision coordinates with the entire skeletal system. I'm actually almost so good that I can touch someone's back and tell them what their visual diagnosis is, or see, yeah, or see the astigmatism. I still need an ophthalmologist to do the script part. I'm certainly not a doctor, but again, like I'm saying, to be able to turn and converge and to move, that's ADD. ADD kids, they can't turn, so they have to see with their chest. Same with autism, has a lot of similarities. I actually believe you shouldn't diagnose autism without a full visual evaluation. Lots of times, really, it's just kids can't see. That's why they're nonverbal.
How do we change that misconception?
First of all, the biggest misconception is, I really feel, and it's not the parents' fault. The parents think that a doctor walks into the room and they know medical as well as development. It's two separate topics, especially in the babies. And so a parent saying, my doctor's not concerned, they want to wait. But what you don't understand, you think when a doctor waits, they're thinking of good. When a doctor waits, they're thinking of how bad can it get before it goes. So it's a completely different concept. it's almost like a different language. And I think that the doctors need to take time, and I say doctors meaning therapists and so forth, they need to take time to understand where a parent is at, as well as a parent has to understand where the
or understand how a patient feels.
right, like with my son, he was in pain for so long, he didn't know what normal was. So they would say, oh, well, he'll let us know when he's in pain. And I'm like, pain is normal for him. Like, it's like you get a smiley face, like when doctors walk in and they say, Kayla, are you in pain today? You're like, are you kidding me? Like, it's that. They're there to make you more comfortable. They're there to make you more comfortable emotionally. But sometimes cases are a little complex, and 10-minute questionnaire is not going to do it.
Or are you tighter?
Um, I didn't understand that last one. Can you just repeat it again with or am I?
Or are you tighter?
Oh yeah, 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 yeah. Oh, I'm sorry. Yes. I misunderstood for tired. No, yes, again, are you tighter? But again, if you're upset or nervous or you don't like the doctor and they just grab you the wrong way, they can, the wrong touch can make someone super CP, especially the little munchkins. They're afraid, they're crying, you go to touch them. Oh, they're spastic, give them Botox. Well, maybe they're just upset. Right? Yeah.
Exaggerated reflex.
Oh, absolutely, because there's a difference between a reflex and emotional touch. That's different. That's intelligence. That's not, oh, I love when they say that's flight or flight. I'm like, no, he's intelligent. He's saying, don't touch me, right?
A lot of babies spend time in NICU. Why is it so important to you as an automatic early intervention patient if you spend 2 days in there?
First of all, no baby was meant to spend time in the hospital. And more than 2 days, they're not getting fed properly, most likely. They're getting IVs, they're getting medical procedures, blood draws done, respiratory distress, leads, all that. They're not meant to have the weight on their bodies, their position, even phototherapy. They put these helmets on, the babies are like this. Um, I really believe that a baby needs to learn how to move at this point, and it should be an automatic. In all countries, a baby that goes home alive, it doesn't matter if they're on a trach or they walk out the door, it's a successful birth. And so parents hear your baby's fine. No, they're fine enough to go home, but that doesn't mean they're going to be fine for short to long-term development or even medical needs. And I think more eyes on the baby at that point is just more successful for the family, for the child, and they just get what they need right off the bat.
How does NICU time still affect us years later?
Oh gosh, first of all, again, the skin is not meant to have holes in it. It's sort of like a ball. If you poke holes in it, even if you tape it up, the ball will start changing direction. It won't bounce right. Our skin regulates all our movements. We're just a bag of bones. We're just a bag of muscles. Our skin regulates all our movements. This is why reflexes are so important because our skin regulates for gravity. Now, with cerebral palsy, gravity is higher than the table. That's where you get that spasticity. With genetics, gravity is lower than the table. That's where you get what they consider the low tone. And so a child within that relationship of gravity and the skin alone makes a difference. And they're changing, sorry to add in real quick, they're putting monitors on the baby, which is Wi-Fi, security monitors. And this is really messing up the babies. It's too early for them to have that kind of weight and Wi-Fi right on their joints. So again, these movements will show up continually because they didn't learn the proper movements, and anybody's trying to move, just like you are or I am, but they'll find their own way of doing it, and that's not necessarily optimal.
Despite my traumatic birth, I wasn't diagnosed until 1 year old.
That's
Why
ridiculous.
do you
Yeah.
feel like CP can be diagnosed sooner?
I actually can tell if a baby has CP within an hour of their birth. Um, Again, I'm not here to diagnose, I'm here to get help. If your parents, and that's where I tell a lot of parents, act like you have it. If you don't, great. But I'm telling you right now, if you're hearing the word cerebral palsy around your baby, act like you have it. Because again, their language is the severity of it. Our language is we have it or we don't. We don't develop CP. The trauma has happened, especially if there's been a brain trauma or oxygen deprivation. That is by definition cerebral palsy, right? And so by helping early on, it's imperative. And also, too, now as a parent, you're more aware if you have needs, if your child's having medical issues. By working with your child more closely, you know the difference if it's medical or if it's cerebral palsy, because it still could be two different things going on.
Yeah.
Like seizures, I don't look at seizures as being a CP. I look at that as more neurological, yes, and so is neuromuscular, but it's still different treatments. You're not going to treat the seizure like you would the cerebral palsy. So,
The government saw more severity and widened the gap for milestones. Please talk about why it isn't okay and affects early intervention.
well, they're saving money. Um, First of all, there's reports out from the CDC back in 2004. They didn't understand why babies were getting worse. So instead of saying babies need to now to meet a higher standard, they made the new milestones to be for the worst case scenario. So if your baby is on track with the government, you're really getting a little bit below typical development. And if you're a little bit behind the government, now you're actually describing that your baby is confirming developmentally delays. So, and then on top of that, they didn't know why crawling was getting so deviated. So they just took it out as a milestone. But now we have, let's say you're a premature baby. So now I love when people say my baby's not born yet, or it's less than a month old, or it's only 2 months old, but really it's 4 months old, or back and forth. But when you're saying your baby's only 2 months old and not 4 months old, they're not delayed yet. And so you think they're going to catch up, but the government's saying, well, they're not delayed, so why give them early intervention? They're not, and it saves countries fortunes. But what it costs countries is later on when they let the severity happen to be too big, that, like, as you know, a wheelchair is a fortune.
Yeah.
The fees really go up as a person is more severe, needing the long term. My son is $1 million baby. He's had, it is what it is. His meds are 35,000 a month.
Wow.
Yeah.
The wait and see approach isn't good, but skipping milestones isn't either. Please talk about that.
We need steps, kindergarten, first grade, second grade. We need steps for our development. Humans develop very slowly. We can't go to college when we're 6 months old. We need the same back in place for milestones. Again, instead of waiting for a doctor to say, oh, I don't think this looks good, let's look for CP. And you were actually early. The average age for cerebral palsy diagnosis is about 18 months when they do the MRI and confirm by having an abnormal brain scan, sorry. They probably looked at you sooner because of epilepsy, and that's why they did it sooner. But if epilepsy is not included in the package, then they will put it off as long as possible because they think it's not that bad because there's no seizures. But by knowing what should happen every month, milestones really start to morph every 4 weeks. And that's where I look at it. And people yell at me that I'm too aggressive. I want your baby on track. Just like I'm not going to say, well, it's okay they missed 10th grade, 4th and 5th grade. It's okay if they just miss those things. Most people say, oh, you're crazy. My kid has to go to 4th and 5th grade. Well, then
Yeah.
why are you missing grabbing your feet? Why isn't that a good milestone to look at? Tummy time now is considered an activity by the government. Crawling is considered an activity by the government. I don't understand this concept, and I'm not going to I'm not going to go. I'm not going to wait and see. And I wish too with my son, someone said, Michelle, your life just changed. And no one did. It was actually a school teacher. I was dropping off my son and she goes, what's with this one? And I said, I don't know. He just is sleeping all the time. And she's like, this is what you need to do. And it was months later after he got sick, months. I continue to lose time.
Learning to fall and problem solving are goals to shoot for. Why is that?
Learning to fall. First of all, we're not organized to fall. Now, you're in a different situation. I'm not worried about being pulled off my couch at all. I'm capable, but I'm not. When you go to move, every move you make is to prevent a fall. So we're totally different on, I don't have to worry about preventing a fall. You always have to. However, when both
Yeah.
of us do fall, you're never strong enough to stop it. You're strong, we're stronger than I'll ever be, but you're not strong enough to stop a fall. I'm capable of falling if I trip over, as is someone else. But when a baby falls, they fall like a squat. When our kids fall, and that was my biggest complaint when Graham first got sick, I said, he falls like a drunk. He falls this way, he falls this way. And the doctor said I was crazy. And I said, but he doesn't fall right. And babies don't learn to fall. They learn to fall really almost when they're going into walking. It's a squat down, getting up. But it's not, and I introduce it as a different type of reflex. And so it's really important that, again, the falling happens because that's a part of your success. But to get any milestone, you have to be able to get in and out of the position. Let's say standing. You have to get in and out of standing for you to walk. You can't just place someone in standing and say, go walk. And
Mm.
so that's why that getting down, not necessarily a fall, is very important. But again, like I said, I'm 60. It's the same conversation to have for old people. I mean, I shouldn't fall back into the couch when I sit down. And that's not
Mm.
a good thing.
What are movement milestones instead of looking for the milestone of walking?
For walking to happen, you have to have 3 major things. You have to be able to look from short to long, like you look from your paper to the teacher and back again. You have to be able to look down the hallway. If a child looks down, like your bicycle, if you look down, you're going to go down. You have to look to where you're going when you're driving a car or whatever, but same with walking. 2, you really need to have, like I just mentioned, be able to get in and out of standing to walk. nobody wants to go in a situation where you can't get out of it. Right. And that's where, to me, I look much more at cerebral palsy. I only have one option, and my option right now is to be here. Right. Let's say if you have more options for movement, then maybe I can bring one arm down, or I can see, whichever is the conversation. And so you have to be able to get in and out of the situation to walk. And three, you really need balance. But balance comes by being able to transition from one foot to the other, right? Balance is not me standing, especially on a piece of wood or a balance plate. If I can't balance on the earth, don't put me up on a table to balance.
Mhm.
We want to go where gravity's our friend, not where gravity's more so more complexities. And so that's how I look at the milestones that need to happen to get into place for walking.
How do you use a laser in your work?
I really use like the laser, but I use it for movement. Most people use a laser for cellular regeneration and maybe healing and so forth. I don't know that vocabulary. Everything that I do with movement, there's an interesting paper out of Russia that shows how certain red lights cause rotation. And what I do actually has to do with rotation. To do all functional movements, you have to have rotation. So the laser can enhance that, especially where people have issues with that.
How do you work with reflexes and movement disorders like spasticity?
So the biggest thing that you're looking for spasticity is, like I mentioned, for all movements like feeding, drinking, seeing my hair, I need rotation. For me to get up out of a bed, I need rotation. When rotation is limited, now you're pushing against gravity versus going through gravity. And you can see that with rockets. That's how my aha was the space shuttle. So when you're looking at someone who has spasticity, I have to look again where they are with gravity, because gravities are as a reflex. That I just did a whole presentation on this. At gravity's a reflex, it's a stimuli. We have it from the day we're born until the day we die. Everything else, we pick up something. I pick up this phone. I choose to do this. Gravity, I have no choice with. And so when someone has spasticity, I have to see where their gravitational point is. And how I do that too is a tip point. Like I can go like this maybe and not want to fall down. You might, if I just move you like here, you might again go into fall prevention.
Yeah.
When you're in fall prevention, you're not learning how to move right because you're protecting, you're intelligent. You're saying, I don't want to fall, which was everybody says, I don't want to fall. And so the more I can work with you to bring you out of that, where you, I shouldn't say feel safe, but that comes out of it. Find places that you can move now and you're not preventing a fall. Now you can start learning new movements and you don't have the spasticity. Like if I put me on a skateboard right now, I would, for whatever reason, the human body, when we feel that panic, we go quite spastic unless we know how to do it.
Stamina and momentum come into play. How do you work on those?
So most people, stamina is a big one for me. Stamina means ease of movement. Stamina doesn't mean more power. The more power you put into it, it actually kills your stamina. And that's why it's much harder for munchkins and adults to move when they don't have good function. So the more you can put in ease of movement, synchronization, you can use all those words, but they mean ease of movement. And that's where you get more stamina. That's the secret to stamina. The easier things are, the more stamina you have. And if people don't believe me, then tell them to start taking their tube of toothpaste off with the other hand. And they'll be like, this is hard. Yeah, it is hard because it's just not easy for you.
How do you make things easier?
Oh, with rotation. The easiest thing is rotation, but also too is again where your gravity point is. If you're going past your gravity point, and again, your question will be coming up about being in a stander. If you're putting someone in a gravitational point that's not for their body, you can call it vertigo, you can call it a vestibular system, then the muscles were overworked unbelievably because they're trying to prevent a fall. Preventing a fall, even subconsciously in our bodies, you can talk to a football player, NFL. If they're hurt and now they're preventing again re-injuring that area, and so they do movements to prevent versus movement that they would naturally do. That's again, it doesn't matter if you're special or not. It comes into play, and it'll hurt you. It'll and the body doesn't want to be hurt. The body's very intelligent.
Why is using a stander not standing?
We actually did a really big presentation at Harvard about that, but a stander again is not standing because when you strap somebody into an equipment, the brain doesn't know to use its body properly. And I've actually invented a stander. I need money to do these things, but I don't know if you're familiar with the metronome, sort of like what's used to keep time for music. But I really want a stander where it could shift your weight and move things. And again, if you get good at it, you can shift your weight and move around. And you can be a stander is important for socialization. It lets you be a part of.
3D.
Sorry, what?
3D.
Yeah, I could use a 3D printer and so forth, possibly. My son does 3D. But or are you saying repeat?
Is it because the stander need to be in 3D?
Yeah, the standard needs to be in 3D, but the standard also needs to move. Yeah, I think you should be able to shift your weight and bear weight, not just being bear weight that gravity is going to pull you into position, but you can shift your weight, you can breathe, you can move. If I have to reach for something, I can shift my weight a little bit, almost like a Segway, where it can shift you and maintain your balance and do things versus that you're just here standing. And I think your brain would be a lot happier and it would get more movement out of the pelvis that would help with the active standing.
Why is having a skill in different directions important?
Oh, the more ways you know how to do something, that's where the intelligence comes from. When like here, I'm in Orlando, Florida. I could come here by plane, I can come here by whatever. But let's say I'm going down your street to get to you. If I only have one way of getting to you, then let's say there's an accident. Now I can say, oh, I can't go see Kayla. I can't, there's been an accident. But when I can go down this street and that street, come around from here, come around from here, not only does it make me more efficient, but it makes me more intelligent. The brain is really happy when it has more ways of doing the same thing. And that's why too, sometimes it's hard, especially when you're in your age, because you're learning how to go from doing things as a kid to an adult. And you're sort of being asked right now to do things a little bit differently than you've been doing it the whole time. And it gets frustrating as a child, but you're just moving up your skill levels that you can do things differently, and that's okay.
Why is verbalizing easier laying down?
Gravity. it is really hard to work with your speech when gravity. All speech happens really after a child is walking. So if there's complications in walking, the language is there, but the actual speech can get pretty impeded. Now, this is yeah, because also too, it depends on your life. Did you have intubation? Did you have sometimes what I do, even in like in my lessons, I have to undo all the hospital stuff. I have a little boy right here. I touched him 3 seconds. I said he's had CPR. He's been revived. So the chest yeah. So I really and she goes, you can feel that? I said, oh yes, but I got it out of him. But the chest compression was still there. Now, saving your life was the most important thing ever, but nobody looks at, okay, now we have to undo the CPR as far as a movement goes. And that's my specialty. Because my son's had so many surgeries and infections, I look at what gets done in the hospital and take it very seriously. It was there to save your life and I wouldn't have it any other way, but now we have to undo it. And intubation, NG tubes, all of that also taken just the tegaderm, all that, and the cannulation. And this is where a lot of kids can't speak because they have that. And I have to undo all of that in a sense, let the movement come out. So lying down is easier for speech because the tongue now is not fighting gravity as much, nor is the face, and nor is the body. If you're worried about falling, you're not giving a lecture. And that's what comes into play. But that goes back to your other question saying, why is having skill in different directions important? You should be able to talk well lying down as well as standing up, and that's what we need to work on.
Has you unlocked any nonverbal people?
Oh, yeah. The child today that I mentioned with his chest compression, he said his first word today, and it was leg. He has a trach and all of that, and he's a cool guy. He's 3 years old, and all of a sudden his mom was like, "Did he just?" So it's fun to catch that. And yeah, because everything that I'm telling you, I'm not telling you as it is a problem. I'm telling you as a solution, and that's where we have to change a lot. I Too many people tell you, and that's where I had problems with traditional therapy. Like I said, they all told me what was wrong, but what was I going to do about it? That's you know.
I still don't like tummy time. Do you know a possible reason for that?
Many reasons. First of all, it's your pelvis. You have a nice long torso, you're skinny. Your pelvis, I can guarantee you just from looking at you, you probably have coxavalga, especially through the right femur. And so coxavalga is when your femur should bend like this into the pelvis, and yours is going a bit straight. So because it's straight, when you're in tummy time, it makes you literally have to get your arms underneath you and prop up like a sphinx pose in yoga. And that's really hard. Now you're not in tummy time. You're at the gym you're trying to push up. And that's not how tummy time works. And so you just don't have the structure in your pelvis for it. And that's okay. What I would be working on instead of tummy time for you, like just even over a pillow and just feel this and just feel that softness as you can raising your head, and that'll give you a lot of the experiences you need from tummy time. Or when you lie down, let's say in your bed, have your feet over the edge of the bed and allow that. But for you to go long with your long legs and your long torso, you're like this trying to push up, and that's just it's just not fair. It's uncomfortable. And I hope that gives you a good answer because that's for you.
Mm. Mm. Mm.
It is just interesting.
Oh, I think it's fascinating. I love it.
Anything else you want to mention?
I want to mention a big thing. Parents go through a lot. Nobody planned for this. You didn't plan for this. Your parents didn't plan for it, your grandparents. But if you feel as a parent that you're questioning any advice that is being given to your child, you're entitled to a second opinion, third opinion, 15th opinion. I can't stress enough. Not everybody knows the answers, but if you feel you deserve one, go get it. Don't settle for the first answer that someone gives you. It's okay to get a second opinion and to be aggressive with your child's needs and your family's needs.
Thank you, Michelle, for doing this with me. It was great to have you on. Please share this talk show with your family, friends, clients, and colleagues. Everyone watching, don't forget to like, follow, subscribe, and share on Facebook, Instagram, and YouTube.